So this is our 17th annual Roberta E. Neustaedter Mini Medical School in Integrative Medicine. My name is Susie Lawrenson. I'm the Regional Manager of the Institute for Health and Healing, or the IHH. For those of you who don't work in healthcare, healthcare loves acronyms. We have to turn everything into an acronym. So the IHH is the acronym we use for Institute for Health and Healing. And we are the Integrative Medicine Department of Sutter Health. And we have clinical services and community programs in Santa Rosa for the past 4 years. And Dr. Drazen is going to fill you in a little bit more about our mission at the IHH when he speaks. So we'll wait a bit on that. And we have a wonderful program tonight. I want to give you a sense of the flow. Dr. Jeff, our moderator, will give you a brief introduction. And then Dr. Sean Zager will speak on the microbiome. After that, Dr. Akhil Palanisamy will present on the Paleo-Vedic diet. We'll then take a short, 5-10 minute break and come back for a panel discussion with questions. And Sharon Mayer, our fabulous nutritionist, she'll join the panel as well. A few additional announcements before we get started. I want to mention that this free public lecture, it wouldn't have been possible without the longtime generosity of Mrs. Roberta Neustaedter. And I'd also like to thank our co-sponsors, Whole Foods, who generously donated the food tonight, and also Red Dragon Yoga and Harmonia. And I just wanted to remind everyone that Sutter and the Institute for Health and Healing is a nonprofit, and we do rely on donations from our community to support many of our services and programs. And also to fund the access to care for financially underserved patients. And so just please let us know if you would ever like to help in our mission. Okay, so now I'd like to introduce Dr. Jeff Drazen, who's going to be our moderator for tonight. He received his medical degree from New York University Medical School, completed his residency training at UCSF. He's also a medical acupuncturist and taught acupuncture to physicians. Previously, he was an associate clinical professor at the Department of Family and Community Medicine at UCSF, and he's been with the IHH for almost 15 years. So besides being a beloved doctor, Dr. Jeff is also co-medical director of the Institute for Health and Healing, and he helps lead all of our clinics and programs at the IHH. He sees patients in San Francisco, so you have to travel a little bit if you'd ever want to go see him. Please welcome Dr. Jeff.
Quirky sense of humor. I didn't realize until the previous mini medical school we had a couple of weeks ago that my first experience of the Institute for Health and Healing was actually at the first mini medical school back in 2000. And I'm surprised that I have the emotion that I have standing in front of you, looking back at what's been a wonderful 17 years and looking forward to what I think will be an exciting time. So I have 3 tasks. One is to briefly speak about the work of the Institute. The second is to introduce tonight's wonderful speakers and panelists, and then to moderate the question and answer period. But before I start, I'd like to kind of get to know you a little bit. So a thought I had is just to do a little survey about who's here tonight and your experience with what might be called holistic health, integrative medicine, alternative health. So let's just start with a show of hands of those of you who consider yourself to be involved and active in some form of integrative, holistic, or alternative health care for yourself. Yeah. Great. And how many of you would define it in the sphere of nutrition? It's either the way you eat, you go to lectures, you're somewhat careful. Great. And how about in terms of more mind-body kinds of practices, yoga, meditation, relaxation? Excellent. And traditional therapies, Ayurveda, acupuncture, Chinese medicine? Great. And I'll just stop there. The Institute started as actually a community education resource. It was a derivative of the program Philosophy in Medicine, and its frame was to really begin to introduce in a conventional medical community environment some of the changes that originate into the 1960s, 50s in healthcare. So if that question was asked in 2000, about half the people would have identified themselves as having any exposure to this, and the large majority of people would have been at their first presentation. Come a long way since then. For those of you who didn't kind of scan the room, we're going somewhere between 50 and 60% of you with hands up at any given time. A very brief chronology of our history. Susie's already talked about a regionalization. We started as a small practice in a 4-room clinic at the campus of California Pacific Medical Center. And within 5 years had moved from a cash practice to an insurance practice as we became very clear that our primary emphasis was to really become a part of standard healthcare. By 2010, we had multiple offices, one starting in Green Bay, Santa Rosa coming on board 2013, Sacramento, an affiliate of ours, coming on board in 2014-15. And I'm not going to talk much about the Institute other than to say we're at this very interesting juncture. And so when we talk about expanding the depth and meaning of health and the transformation of actual healthcare practice, it's always bidirectional. We're being transformed because we're asking ourselves the questions of how we have to change to actually make what we do things that can happen in any medical environment, as well as bringing forward the kinds of things that you've begun to experience and seek out in terms of what you'd like the broadest range of your healthcare options to be. We're delighted to be here tonight and continue that work. I'm going to introduce Sean. Sean Zager is a resident of Sonoma County and a practitioner in our Green Bay Marin practice. He did his undergraduate training in Michigan, University of Michigan. He did his, this is an easy one to remember, he did his medical school at the University of Michigan. He did his integrative medicine fellowship at the University of Michigan. His practice includes botanical, mind, body, and structural medicine, along with the tools one acquires as a conventional board-certified family physician. Those of us who know Sean and his practice know him as a reflective, thoughtful, caring, and compassionate practitioner. But it wasn't until this November that I understood the depth of his scholarship. So I was at a primary care-oriented cardiology conference, which was a range of cardiologic topics, but very specialized areas of care. And Sean was there speaking about nutritional medicine. And if I could identify in what is a fairly challenging environment to be introducing this stuff, there was, without any question, more engagement with the audience in Sean's presentation as he came from the stage and had a line going back, 10, 20 people. I think you're in for a really wonderful presentation, and without further ado, Dr. Sean Zager.
Hey, everybody. My name's Sean. I'm the Michigander here tonight. Maybe not the only one. I'm here to speak about the GI microbiome. But before I do, I want to say thank you to the Institute for Health and Healing and to Dr. Akhil Palnasamy for having me speak here today. I also want to thank everybody in the audience for coming. This is an incredible turnout. Really appreciate your interest and support. So I want to explore the gut. I want to hop inside the gut. I hope that you'll join me here to take a look around. Okay. Our gut, from the mouth to the anus, 30 feet long. surface area. If we took our gut and with all its folds and microfolds and spread it out, it's a really big surface area. Who knows? Who could have a guess about how big that surface area is? You can raise your hand or just call it out. So, right, those are so tennis court, football field. It's actually neither of those. That's commonly been thought. It's actually a little smaller. It's about 40 square meters, which is about 3 times the size of this stage. A little bit less than that, but still pretty huge if you think about that surface area to serve us. Within this gut, there is 3 pounds of bacteria alone. Yeah, it's a lot. Yeah. In those bacteria, about 500 to 1,000 different species of bacteria. Now, I'm sure you guys have heard this one before, but in and on our body, there are 100 trillion bacteria, and those are single-celled organisms, so 100 trillion bacterial cells, and we walk around with only about 10 trillion human cells, so we are only a 10th human. And that's on a cellular level. On a genetic level, we have 100 to 150 times more bacterial genes in and on us than we do human genes. Okay, kind of interesting to appreciate that. Within the gut, obviously, these bacteria are vital for our digestion and absorption of nutrients. But also, our gut bacteria is really inseparable from our immune system and our nervous system, our neurohormonal system, as they aid in our detoxification and our vitamin production. And we'll speak a little bit more about that here. So one of the main things that our gut bacteria do for us is they take the carbohydrates that make it through to the intestines undigested, really down to the colon undigested. They ferment these carbohydrates into what are called small-chain fatty acids, or SCFAs. These are used in many different ways by our human cells and really are required by our human cells for many functions. They're a major source of nourishment for the cells of our intestines to be able to do what they do best, and that's absorb our nutrients, and also to help create the barrier to keep certain things out of our body, right, and to be excreted in the stool. So they need those small-chain fatty acids that are produced by our gut bacteria. In addition, these small-chain fatty acids make their way to other parts of our body, like our muscles and our liver, where they're needed to create ATP. And for many of you probably have heard of ATP, but this is our main transporter of energy between and within our cells. So to have ATP, to have energy, we need these gut bacteria. In addition, we have an immune system that is entirely devoted to the gut. Okay, this is in medical speak. This is called the gastrointestinal, the gut-associated lymphoid tissue, the GALT system. But what you need to know is this lymph tissue in the gut is 70 to 80% of all the lymph tissue, all the immune tissue in our body. Which makes sense if you really think about it, because our gut is such a central interface that we have with the outside world. So it makes sense that evolution, that we've evolved to have so much of our immune system relegated to our gut. And now this immune tissue could not proliferate or maintain itself without these small-chain fatty acids that are produced by our gut bacteria. Beyond this function of the gut bacteria, it also produces on its own vitamins for us to use, vitamin K, B vitamins, vitamin C, even glutathione, which is a molecule that we need for our own detoxification. This gut bacteria also helps to maintain a healthy balance in the, I'd say, delicate ecology within our gut. Now, how many of you guys out there, if your doctor told you that he or she had found yeast or candida or parasites in your gut, how many of you would be concerned if not totally freaked out? You can raise your hands if you want. Yeah, a lot of you guys. Yeah, right? So the truth is that we all have yeast and candida and parasites in our gut. We do. It's there. It's naturally there. It's meant to be there. What we want is for that to stay there as a colonizer, in its expected state, and not to overgrow. And it's the gut bacteria that really police this, that really regulate this by competing for nutrients, by competing for attachment sites, by producing enzymes that can limit the growth of this yeast or parasites or other bacteria that can be potentially pathogenic. So these are some reasons why our gut bacteria is so important to our health. Now, I mentioned that we have an immune system that is specific to our gut, and a really huge segment of our immune system being devoted to our gut. We also have a nervous system that is entirely devoted to our gut, and it's called the enteric nervous system, the ENS. This is commonly known as the second brain. It's gaining notoriety. Many of you may have heard of it as an important part of what's becoming known as the gut-brain axis. This enteric nervous system, this nervous system of our gut, has more neurons, and that's our nerve cells. It has more neurons than are found in our entire spinal cord. These neurons within the gut, they communicate with over 30 of the same neurotransmitters that are found in our brain. So I'll ask another question to the audience here. You can call it out if you know the answer. Where in our body, what part of our body has the most, utilizes the most and produces the most serotonin? The gut. Good call. You're right, it is the gut. But did you know that over 90% of the serotonin in our body is in our gut, produced in our gut? About 50% of the dopamine, another neurotransmitter, in our body is produced in the gut. And did you know that the gut bacteria actually produce serotonin and dopamine and other neurotransmitters? In addition, there are specialized cells in the intestine that produce these neurotransmitters as well, but they need our gut bacteria to signal them to produce and secrete these neurotransmitters. So, again, I mean, what would we be without all of this bacteria, this 3 pounds of bacteria in our gut? This sounds, I mean, this is, hopefully this is some new information for you guys, and, it's quite amazing. But really, we knew this since the time we were children, right? We always heard the sayings of, go with your gut. It's a gut feeling. Or I have some butterflies in my stomach, just like I did before I hopped on stage here. And these are sayings we've always known that there is an intimate connection between our GI tract, our gut, and our emotions and our mental state, right? More recently, there's been a lot of animal studies showing that when animals are deprived of healthy gut bacteria, they have increased anxious behaviors, behaviors of depression. They have decreased memory. They have decreased ability to modulate pain and stress. So this is something now that's getting a lot more study, just to be, which I think is good, to be shown in the literature that we need our gut bacteria, and it has so much to do with our health, both physically and mentally. One other piece about the gut-brain axis that I want to be sure I mention is, so the main avenue of communication between our enteric nervous system, this nervous system of the gut, and our central nervous system, which is our spinal cord and brain, is the vagus nerve, okay? many of you may have heard of the vagus nerve. It's a huge nerve. It's the biggest cranial nerve in the body. It runs from the brain down to the intestines, has many attachment sites in between. And what's important to note is that the vagus nerve does its job best when we are in a restful state. And again, this is something that we've all known since we were kids, because we know there's fight or flight, and we know there's rest and digest. And we'll come back to this a little later, but I think that's an important point as well. Okay. So now that we've reviewed how far-reaching our gut microbiome is in the maintenance of the health of our mind and body, let's talk for a second about some things that can disrupt the GI microbiome and create a scenario called leaky gut phenomenon. Just with a show of hands, who's heard of leaky gut phenomenon? Right. Wow. I think everybody in the room just raised their hand. Okay. That's great. I mean, this is something that used to be a very fringy idea, only talked about in the fringiest of alternative medicine circles, but now is being well accepted across the board by gastroenterologists and in conventional care. What is leaky gut syndrome? It seems like everybody already has an idea about it. I'll just say that basically it's what happens when, usually due to inflammation, there's a disruption in that delicate balance in the ecosystem of our guts, and our intestines, which are meant to be this semi-porous membrane that absorbs our nutrients the nutrients we need, and keeps out the food particles and toxins and beyond that we don't need. That barrier, the integrity of that barrier becomes compromised, and instead we aren't able to absorb our nutrients that we need as effectively as usual. And instead, those food particles and toxins get into our system when they shouldn't, get into our bloodstream. Our immune system sees those things and says, what is this? I don't know what to do with it. It leads to autoimmune phenomenon and inflammation in other places in the body. It can really affect any organ system. So that's, in a nutshell, what leaky gut phenomenon is, and it's pretty rampant. So what can cause that? It's a long list, and I'm not going to go into detail about each thing that can cause that, but you could probably extrapolate. From childhood, I mean, we know that a cesarean birth is one thing from the start that can predispose a person to disruption in their gut microflora. Not being breastfed, being raised in too sterile an environment, really not spending enough time in the dirt or with your pets or with other kids, ways that we have evolved to grow up for eons, right? Medications, antibiotics, chronic use of steroids, chronic use of proton pump inhibitors like your Nexium or Prilosec. These can disrupt the gut microflora and lead to a leaky gut phenomenon. Dietary choices, pro-inflammatory diets that might include, there might be personal, individual allergies or intolerances, the most common being gluten, dairy, egg, corn, soy, but also heavily processed foods, GMOs, foods that have been exposed to exogenous hormones or antibiotics or pesticides, right? It's important to think about what we're eating and how it affects our gut. Of course, GI infections, introducing other parasites or bacteria or yeast or viruses that don't belong in our gut. And finally, chronic unmanaged stress, right? This is something that in itself, and this may be the most common cause of leaky gut phenomenon, certainly one that I see often. So beyond the expected gastrointestinal and psychological distress that can be caused by leaky gut syndrome and this disturbance in our gut microflora, it's also been associated with many disease states, right? And this is something that, again, in the last few years, this is exploding in the medical literature. There's tons of research happening on this now. We've seen associations with these disruptions in the gut with obesity, diabetes, both type 1 and type 2, high blood pressure, autoimmune diseases, as I mentioned already, like rheumatoid arthritis, inflammatory bowel diseases like Crohn's or also ulcerative colitis, asthma and other atopic diseases, autism, even colorectal cancer. This is a huge area of study right now. You're going to be hearing more and more about this. So if this is something that you would like to learn more about, whether in terms of how to diagnose it or how to treat it, definitely talk with your physician about it, or your naturopathic physician, or your primary care provider, your gastroenterologist, your nutritionist, and beyond. Talk with your healthcare provider. This is where I put a little plug in that you might want to. It may be helpful if your provider has some training in functional medicine. This is a model of integrative care that really is at the leading edge of diagnostics and treatment protocols for these kinds of GI dysfunction. And if you want to learn more about this, get your hands on Dr. Akhil Palanisamy's book, The Paleo-Vedic Diet. It goes into all this in much greater detail. It's phenomenal. It includes a bunch of recipes also provided by Sharon Mayer that are meant to support our GI microbiome and are delicious on top of all that. Of course, treatment plans for this GI dysbiosis, that's what I would call it, this disruption in the gut microbiome. Treatment plans obviously are going to vary per individual, but they'll often include perhaps probiotic supplements or probiotic foods that I'm sure many of you are familiar with. That's the foods that contain these good, friendly bacteria. That might be your kefir, your yogurt, your pickled or fermented veggies like sauerkraut or kimchi, miso, kombucha. Prebiotic foods would also be a consideration. Those are the foods that contain the types of resistant starches and sugars that feed the good bacteria, and that includes yams and sweet potatoes, garlic, onion, artichokes, beets, asparagus, and beyond. Again, this is all detailed in Dr. Akhil's book and in the recipes. A treatment plan also often would include techniques for stress management. On that note, I'm going to make a shift as the last part of my presentation here from this left brain information sharing, which I think is very important, big reason why you came here, to a right brain information sharing for those who would like to join. I'm going to invite the audience, for those who would like to sit in your chair, ideally with your spine straight and your feet on the ground. Great. Thanks. And, yeah, if you have things in your lap, maybe put it down on the ground and just, perfect. Thank you. And when you're ready, just put your hands on your belly. Okay, great. And take a few deep, deep belly breaths. Good. And as you do that, remember that this is one great way to stimulate that vagus nerve that helps us to rest and to digest. And either keep your hands on your belly or let them lie gently in your lap. And if they're not already, feel free to close your eyes gently. And move your attention to the top of your head while you continue this deep, deep belly breathing. And follow a flow of relaxation down from the top of the head along the scalp, allowing those muscles to relax and release, passing your attention down over the muscles of your face and around your eyes, letting those muscles release any tension that may be there, becoming loose and lax. Passing your attention down over the back of your head and over your face, being sure to include the muscles of your jaw and around your mouth and your tongue. Just letting go completely, letting those muscles become calm and comfortable. Following that flow of energy down of the neck and the shoulders. Dropping those shoulders and letting them just be draped on the shoulder bones. And like 1,000 fingers, just massaging the muscles of the shoulders and down into the arms. Follow that relaxation down into the forearms and hands and fingers. Like you just took off a pair of tight-fitting gloves and now your hands and fingers can be free and at ease. And follow that flow of relaxation down over the chest and the upper back. Down over those larger muscles of the back, letting them unfurl and unfold and unwind and unravel completely and fully. Passing your attention down to the belly as you continue that deep belly breathing, that Buddha breathing, helping us all move into a deeper relaxation, more of a restful state. As we continue that deep belly breathing, we can pass our attention down through the hips and thighs, loosening and lengthening, becoming soft and smooth. Following that flow down into the muscles of the lower legs, melting, becoming comfortable, fully relaxed, down through the ankles, feet, and toes, down to the tips of the toes, feeling a new, deeper sense of relaxation through every cell of your body. You can move your attention back to the belly, where we'll all take a few more deep and nourishing breaths through the belly. And as I count to 3, we'll become more alert and refreshed in the room. 1, feeling quite wonderful and relaxed. 2, knowing that we can take with us anything that feels valuable from this experience. And 3, with a sense of gratitude for sharing this journey together and coming back to the room and wiggling toes and fingers and gently opening eyes. Thank you for sharing this with me. Appreciate it.